My name is Omida Dalati, and you're watching Skyrise Media Society and Parvus TV. Today, we're joined by Bowen Ma, BC's Minister of Infrastructure and MLA for North Vancouver and Lonsdale. She recently met with the federal ministers and MPs in Ottawa to advocate for the BC's infrastructural priorities, including a major $11 billion investment in healthcare facilities over the next 3 years. We're here to learn what this means for the communities across the province. Minister Ma, thank you for joining us.
Thank you so much for having me.
You recently met with the federal ministers and MPs in Ottawa. What were the key priorities you emphasized for British Columbia?
Yeah, so it's really important that the government of Canada remembers that British Columbia is here. We're very far away from Ottawa, and it can be easy for MPs and the government of Canada to forget about us. And so, what me and my colleagues have been really active in doing over the last year or so is increasing our presence in Ottawa and ensuring that they understand that British Columbia is positioned to be the economic engine for Canada, particularly in the context of this trade war and changing global economic dynamics. One of the major pieces that I personally brought as Minister of Infrastructure is to Ottawa is to let them know about the incredible work that we're doing here to build healthcare infrastructure and invite them to partner with us. Now, we don't have to invite them too hard because they're very interested in partnering with us. And so those conversations are part of the work that we do to make sure that we're able to benefit from the support that the government of Canada can offer British Columbians.
Absolutely. How did the federal government respond to your request for support on BC's healthcare and infrastructure?
I think that we share a lot of goals and priorities, one of which is delivering the that Canadians need from coast to coast to coast. And here in BC, we have one of the most ambitious capital infrastructure programs that have been attempted by province, certainly here. The most historic investment that have been attempted here in BC. And I think that there's a lot of interest in the opportunities that exist for partnership at senior levels of government.
Absolutely. And the partnership that we talk about, the province has committed 11 billion over the next 3 years. What specific projects will this funding prioritize first?
Yeah, so BC's currently implementing the single most ambitious capital infrastructure program that our province has ever attempted. In my ministry alone, that amounts to $20 billion over the next 3 years, of which $11 billion will go towards healthcare infrastructure. And so that means money for more hospitals and acute care facilities, money for long-term care homes and urgent primary care centers. This work has been ongoing for many years. Since 2017, we've already completed 14 major new and upgraded hospital projects or healthcare facilities, 16 long-term care homes, 48 urgent and primary care centers. And beyond healthcare, we've also been delivering new school seats, K-12 school seats, amounting to 23,600 new student seats in public K-12 sector, 33,000 seismically safer seats in the K-12 sector, and 7,300 new student housing beds as well. But the work isn't complete. There's still more to do. And so that's why we continue to commit funding in this current budget for future years. And that money will go towards 17 additional major hospital and acute care facility projects, 66 major K-12 school additions and improvements, and 3,900 new student housing beds and more. And of course, this doesn't even include our investments into delivering the new Surrey Langley SkyTrain project that's currently underway. We've got the replacement for the George Massey Crossing. Work is underway for that as well. And we're building the first new medical school in Western Canada in over 55 years. So lots of really ambitious work happening here in British Columbia, and we're proud to be leading that work for people.
It's great to hear about the plans that are coming up, and I'm curious to see how will these investments directly improve access for everyday British Columbians, especially in growing communities.
Well, I think everybody has heard of the experience of growing communities when it comes to access to public services that maybe haven't grown as quickly as the population has grown. And so, in growing communities, more schools and expanded schools really means that growing families can be confident that their children have places to be educated and to thrive and to prepare for the future. And that means that their parents, who are often bringing critical skills into communities, can be confident that they can actually set down roots and and become a part of the community. And that includes healthcare workers as well. So when we build more healthcare facilities, it helps it helps health authorities with recruitment and retention. It's a lot easier to get um, it's a lot easier to get really highly trained doctors and nurses and healthcare workers to move into a community when you have a brand new hospital to allow them to serve in. It also means that when we're delivering high efficiency, state of the art uh, healthcare facilities with the most recent technology, it also means that we're able to use staff time more wisely. And so those doctors and those nurses and healthcare support workers and technicians can actually support a greater population because they've got high tech uh, high tech facilities that allow them uh, treat people uh, to treat people efficiently and do the best that they can. You can tell my background's in engineering, not in healthcare. So if you're asking me questions about healthcare, I'm not going to be as articulate on it. But suffice to say, our hospital projects really are leading edge in BC. We've got several major hospital projects already underway. Well, as I noted, we've actually completed several major hospital projects, but we have more currently underway. If you live in Surrey, you just have to drive by the new Cloverdale Hospital there that's rising up out of the ground, a multi-billion-dollar hospital project. We've got the St. Paul's Hospital project that is almost complete in Vancouver, also a state-of-the-art hospital. Here in North Vancouver, we recently opened the new Lionsgate Hospital Acute Care Tower, and that's already serving people in our community. So lots underway for sure, and people in communities will be able to benefit from all of those kinds of investments.
Absolutely. Canada ranks amongst the top in healthcare, and I'm very happy to hear about the infrastructure plans that are coming. Long-term care and cancer centers are highlighted, though, and I'd like to know why these areas are particularly urgent right now.
You know, I would say that all of our healthcare service expansions are important because our population is growing. Now, I will say in the last year or so, our population growth has slowed down a little bit. But people will know that between 2019 and 2023, we saw population increases in Canada and here in British Columbia in particular at rates that have never been seen before. And so, what does that mean? That means that in communities, a lot of families will notice that it can take longer to get into hospitals. It can their schools feel a little bit more overcrowded, and that's why we're trying to rush to build more space. But when it comes to long-term care and cancer centers, we're working on the former. We also recognize that British Columbia has an aging population. And so, as our parents and our grandparents age, many of them will require at some point, not all of them, but some of them will require at some point full time care uh, in a more clinical setting. And so, the work that we're doing on long term care is incredibly important. We've delivered 16 new long term care homes that are uh, owned and operated by public health authorities already, but we also want to deliver thousands and thousands more. And so we're actually undergoing a process right now to reevaluate how we deliver long-term care beds so that we can do them cheaper and faster, or more cost effectively and faster, while still providing a high quality of care. And part of that work will involve standardizing designs and using innovative construction technologies and techniques like prefabrication. When it comes to cancer centers, one of the focuses our government has undertaken over the last many years is to actually provide cancer care in more communities. Now, we're very fortunate here in the Lower Mainland because we have many different hospitals that provide various types of cancer treatments, and they're all within a relatively short distance from one another. But in other parts of the province, there are communities where people who require cancer treatment will travel 8, 12, even 14 hours each way in order to access that life-saving treatment. And so part of the work that we've been doing as a government is actually to create new cancer centers in places where they haven't had that kind of those kinds of cancer treatments before.
Awesome. That's great to hear. Minister Ma, I'd like to ask, what challenges do you anticipate when it comes to coordinating funding and timelines with the federal government?
I think that British Columbia has generally demonstrated itself to be a very strong partner with the government of Canada. We have a lot of shared priorities, a lot of shared goals, and we've been able to accomplish a lot through partnerships. At the same time, we need Ottawa to understand that British Columbia exists in a context that is different from many other provinces as well. And so a solution or a condition to access funding that works for Ontario might not work for BC. So part of the work ahead of us is really making sure that Ottawa understands British Columbia better, and about ensuring that we understand their conditions for how we can access federal funding. They have noted to us, for instance, that they really want to motivate more housing development, which is great because that's something that we want to do too. But one of their priorities and conditions for accessing funding is the reduction of development cost charges. Now, in principle, we support this. However, we also have to recognize that many local governments and municipalities depend on development cost charges to pay for critical infrastructure like sewage, water, community amenities, and so forth. And so we want to make sure that when we are working with Ottawa to meet their conditions, that we're not unintentionally harming local governments and communities' abilities to keep pace with the needs of their communities. So a lot of conversation about what that looks like here in the BC context, and I'm optimistic that we'll be able to reach a deal with the federal government.
Hopefully. And how will how will this plan address the current pressures in the healthcare system, such as wait times and staffing shortages?
Yeah. So, I mean, we spoke a little bit to that earlier. And I want to acknowledge that you're absolutely right. Building a new building doesn't automatically create new doctors and nurses and healthcare workers. And a lot of the challenges and pressures that we face in communities are actually staffing challenges. Now, there are a few ways that capital investments help improve that. We talked about some of them earlier, where a new hospital attracts staff and is able to retain staff much better than a very old and old hospital that's falling apart. Um, Integrating the latest technologies and really thoughtful designs increases the efficiency and effectiveness of staff hours, so that a nurse is not spending too much time running around in circles looking for equipment. Maybe we can design the facility better so that the equipment is right there for them. At the same time, our government is doing a lot of work to increase the recruitment of healthcare workers from out of province. We had a very successful campaign down in the United States, attracting hundreds and hundreds of new healthcare workers to come live in British Columbia. And many of your listeners will know that there's a lot of work that still needs to be done to
Oh yeah.
further improve the ability for Iranian trained doctors to work here. This is something that, on a local level, as an MLA for North Vancouver Lonsdale, has been a priority for me. And there have been some improvements in the work that we're doing with the College of Physicians and Surgeons on this, but it's not nearly enough. It is such a waste that we have so many highly trained Iranian doctors here in BC, ready to work, ready to serve their community, and they get stuck at the credentialing and the licensing stage. It's really unacceptable to me. And as a local MLA, this will continue to be a priority for me in advocating through the BC government, but also in our work with the College of Physicians and Surgeons, that we really need to secure a firm pathway for Iranian doctors to be able to work here in the communities that they now live in.
Thank you very much for addressing this, Minister Ma. What role do local communities and municipalities play in shaping these infrastructural projects?
I mean, community infrastructure is delivered at a number of different governmental levels, right?
Hmm.
The type of projects that my ministry and the province delivers directly will be projects that are like healthcare facilities, publicly owned and operated healthcare facilities, publicly owned and operated K to 12 schools, post secondary institutions, though or provincial transportation projects and so forth. But local governments and local communities are very involved in the delivery of local infrastructure, like recreation centers, also very important for growing communities, streets and local streets and sidewalks, and active transportation networks. Uh, the local utilities are delivered at the local community level. All of this needs to, I mean, there's obviously interplay, right? You can't grow a community in population and expect it to be sustainable if we are not also simultaneously improving our healthcare infrastructure our and our school infrastructure. So there's a really important role in terms of development planning that local communities play and municipalities play in shaping how all of this comes together.
And how will these infrastructural investments benefit local communities, especially residents in your riding of North Vancouver, Lonsdale?
Yeah, I mean, we're already benefiting from a lot of from so many provincial investments. Uh, I mentioned before that the new acute care tower at Lionsgate Hospital has opened and is already benefiting community members. We also have a new elementary school underway. It's called the New Cloverley Elementary School in my riding in North Vancouver Lonsdale, as well as additions to Westview and Lynn Valley Elementary Schools. Those are one is complete and one is almost complete. This is in addition to other investments that we've made in schools. We've completed the new Argyle Secondary School. We've completed the new Handsworth Secondary School, seismic upgrades over at Westview, pardon me, Mountainside Secondary School. We've made investments in school playgrounds. We are currently building a new student housing facility at Capilano University. We've built childcare right across not just across province, but across North Vancouver as well. But despite all of these investments, there's still more work to be done. And so that's why we continue to do the work that we've been doing and why we continue to invest in communities.
Absolutely. With the growing community, it makes so much sense to work on these plans, implement these plans, and I'm happy to hear that we have so many undergoing. I would like to hear whether there is anything potentially global, or is there any plans that we have that could essentially work towards the economy of Canada, or any plans within the community
Uh,
that you'd like to further discuss?
Sure. So BC, as I said in the beginning, is well positioned to be the economic engine of Canada because we are a province that is rich with valuable resources. We are filled with highly skilled experts and hardworking people who are ready to get to work for Canada as a whole. We have a number of major projects that are underway in the province, mines, uh, energy projects. Uh, we have so much to offer to Canadians by way of contributing to more secure supply chains, contributing to more diverse economic development opportunities. We're a tech hub. And so all of this, although not in my area of expertise, uh, is work that our government is doing and pushing for the government of Canada to recognize. We are ready to help Canada become a stronger country and ready to partner with the government of Canada to do so.
Well, Minister Ma, I'd like to ask, what would a successful federal provincial partnership look like for BC's healthcare system in the next few years?
Yeah, so we are, like I said earlier, in conversations with the federal government over the provincial and territorial stream of the Build Communities Strong Fund. So, Government of Canada has uh, put on the table $17.2 billion for across Canada to support housing, post-secondary education, and healthcare infrastructure projects. And BC's allocation for that is about $2.2 billion, of which about 600 million is meant to go towards healthcare. As I said earlier, our provincial plan right now is about $11 billion. So we are already investing an enormous amount of money into improving healthcare infrastructure, but we welcome the additional help from Ottawa. So to access these funds, Ottawa has set out a number of conditions for how provinces can access these funds. So we've been working closely with the federal government to uh, to help us come to a mutual understanding of how we meet those conditions so that we can access funding, so that we can actually expand our healthcare investment program. I'll also note that now that's on the capital side, so that means that's on the building side. But when it comes to operating on the operational side, so the staffing side and the delivery of actual services, there have been a number of conversations underway between the provinces and the federal government for several years now about the health transfers that they provide to provinces. So, way back when, Canada and the provinces used to split funding costs for healthcare services about 50-50. But over the years, the contribution from the government of Canada has not increased, and the provinces have had to fill in the gaps to the point where now about 80% of all healthcare funding comes from the province and only 20% comes from the federal government. Now, given the strains that we're seeing in healthcare systems right across the country, a lot of provinces, led by BC for many years, have been going to the government of Canada to push them to increase their health transfers. We're saying, hey, we need more help to deliver the kind of healthcare services that British Columbians and that Canadians expect and rely on. So we're hopeful that there's still a pathway available for all of us together to work towards a more equitable funding share when it comes to healthcare service delivery.
Absolutely. Well, thank you so much, Minister Ma. Thank you so much for joining us, and your input has been super informative. We hope to collaborate again, If you have any comments or questions, feel free to reach out to skyrisemediasociety@gmail.com. Thank you, and I'll see you soon.